When Christopher Columbus crossed the Atlantic in 1492, he carried with him diseases which all but wiped out the native Indian population. Their revenge, according to history, was to send back to Europe the scourge of syphilis. But now, a skeleton unearthed in an English monastery can at last put the record straight. This is the true story of syphilis.
Hi, I'm Dr. William, and today we will talk about syphilis disease. What is syphilis? Syphilis is a sexually transmitted infection, STI, caused by the bacterium Treponema pallidum.
Syphilis can be classified as early or late based on time of acquiring infection. Usually infections of less than or equal to 2 years duration are defined as early, while infections of NGT, 2 years, are defined as late. Furthermore, infections can be classified as primary, secondary, or tertiary based on the clinical presentation. Syphilis is usually acquired through sexual contact with infectious lesions on the mucosa or skin, or, much more rarely, through the bloodstream. The infection can also be transmitted from the mother to her fetus because Treponema pallidum can cross the placenta, causing congenital syphilis, which could lead to fetal death or development of fetal infection. Well, when I want to check whether this disease actually exists, what do I do? Let's go check it out. One, microscopy of skin and tissue samples observes the bacteria causing syphilis under a microscope. 2. Serological tests. Treponemal tests detect antibodies to treponemal antigens. Non-treponemal tests detect antibodies that react to lipids released in response to cellular damage caused by infection. All tests are negative initially in primary infection. Both treponemal and non-treponemal tests need to be positive to confirm the diagnosis. Procaine benzyl penicillin plus probenecid. Treatment duration: 14 days. Early syphilis. A single dose of benzathine benzyl penicillin. First choice: procaine benzyl penicillin for 10 to 14 days. Second choice: late or unknown stage syphilis. Benzathine benzyl penicillin. First choice: 1 dose per week for 3 consecutive weeks. Procaine benzyl penicillin. Second choice treatment extends for 20 days. Syphilis in pregnancy. Benzathine benzyl penicillin is the drug of choice. In case of early syphilis, a single dose is indicated. For late or unknown stage, 1 dose per week for 3 consecutive weeks. In case of allergy to penicillin, we can use alternative options such as ceftriaxone 1g for 10 to 14 days. 1. Treatment is always indicated and infection is diagnosed, including asymptomatic patients. 2. In early syphilis, primary/secondary, partners should also be treated if exposed within 90 days. 3. Assess serological response by repeating non-treponemal test to detect a reduction in titer. A 4-fold reduction in titers confirms adequate response. Repeat 3, 6, and 12 months after the end of treatment. Sexuality education. Promoting consistent use of condoms. Pre- and post-test counseling. Interventions targeting high-risk groups. Access of pregnant women to early prenatal care, including screening at first visit and immediate treatment initiation if needed to prevent